So the SVS Wellness Task Force, really championed by our leadership within the SVS, surveyed all of the membership, and we were extremely grateful to get a response rate of about 33%. So our members have provided really important feedback to us, suggesting that burnout, depression, and suicidal ideation are very real problems within our society and our workforce. It's been well described, really across the entire medical profession, that physician burnout is a problem. It's been dubbed an epidemic, if you will. It impacts more than 50% of our workforce, if you look across specialties. And the risks really are related to both personal and professional ramifications. So it compromises patient safety, it compromises patient satisfaction, productivity, physician retention, and then the personal ramifications can be really compelling and striking. Alcohol use and trouble with relationships and really culminating in suicide. Using validated survey metrics, we were able to identify that about 40% of our workforce in that moment of survey met criteria for burnout. And that was based on high scores with emotional exhaustion and depersonalization modules. About 35 to 36% of our surgeons are suffering from depression just in the last month. And if you look at those surgeons that met criteria for burnout, the incidence of depression doubled to over 60%. And what was most striking, in fact, was that 8% of our vascular surgery workforce is describing suicidal ideation just in the last 12 months. And again, if you look at those surgeons who met criteria for burnout, that risk is doubled to 15%. And so this is a real profound problem. The SVS is obviously committed to this issue for a variety of reasons, in part because we care about our membership and their wellness, in part because we care about our workforce, which really urgently needs to be protected, maintained, and grown. The SVS is focused on its membership, and some of this is big and broad action that's already underway, focusing on our brand, our value as a specialty. This gives us the ability to negotiate for more efficiencies, to negotiate for more resources. I think, though, at a different level, what's important are the human relationships. And so what really didn't come out from the objective scores or data were the kind of human stories and free text that I've had the opportunity to review, and all of the membership hasn't yet had the opportunity to review. But I would suggest that we have members who are hurting and who are struggling. And my sense is that there are individuals in practice who feel isolated, who don't have the peer support or the clinical support perhaps to navigate adverse outcomes, those tough cases that really stick with us, navigate how to make the best decision or the right decision in critical moments, as an example. And I think that as a society and as a community, we can do more to help each other, to be accountable for each other. And so some of the efforts I'm really most excited about that the SVS is considering supporting and sponsoring would be member support, peer support, really at a tiered level that involves individual resources and metrics, but also the opportunity for coaching and kind of small group learning and peer support modules. I think I just want to thank the SVS for its vision and its leadership, for recognizing a really uncomfortable problem, and to be really forward and intentional about addressing it.